All right. Good evening, everybody. Thank you for joining us tonight for this discussion on enlarged prostate. It's great to see both new and familiar names joining us tonight. Um, my name's Jason Lomboy, and I'm a urologist with Advanced Urology in Marietta. And tonight we're going to be talking about the enlarged prostate. What are the symptoms of enlarged prostate? Diagnosis and treatment options. So we'll go ahead and get started. I think there's maybe a couple more that are trying to join, but they can join when they get a chance. So on our agenda tonight, we'll be talking about a few different things. We'll talk about kind of what is enlarged prostate, or also known as BPH, or benign prostatic hyperplasia. How's it diagnosed, and what are the treatment options? So just to give an overview of the prostate, it's a gland that sits at the base of the bladder and surrounds the urethra. Its primary function is to produce fluid that helps to transport sperm during ejaculation. And it's normally a walnut-sized gland, but as we'll talk about, that the growth of that gland can cause some problems. So if we look at the anatomy and growth of a prostate over time, typically the prostate grows to a normal walnut size in the teenage years, and then begins to grow significantly again after the age of 75 until later in life. There are a number of different conditions that affect the prostate, all which are very different, treated very differently. There's prostatitis, which is typically a temporary swelling or inflammation of the prostate. There's also prostate cancer, which many of us are familiar with, a common cancer among men, and typically a slow-growing cancer, but not always. And then there's enlarged prostate, which is enlargement of the prostate gland. And each of these conditions really affects the prostate differently. Having one condition does not mean you will have another. In other words, having an enlarged prostate doesn't mean that you're more at risk for prostate cancer. When we look at how the prostate affects us as we age, in general, it affects 40 million men each year in the United States. And then by age 80, it affects almost 90% of men. So, and as early as age 50, you can see here 40% of men. So gradually, involves more and more men, and almost all men by age 80. So again, BPH is benign prostatic hyperplasia. Again, as the name, resembles, it's benign. It's a benign condition, so it's not related to prostate cancer. It's a non-cancerous enlargement, and it's not a predictor of cancer. PSA, which many of you have read about or heard me talk about in clinic, it can rise both with BPH and prostate cancer. So PSA alone does not tell us which is the issue. So when we look at kind of what does a normal versus an enlarged prostate look like, as the prostate enlarges, really what the problem is, it puts pressure on the urethra and causes the bladder, which is a muscle, to generate stronger contractions and really build up as a muscle. Many of you, I think, have said to me, even in clinic, my doctor told me my prostate isn't that enlarged. Well, it's actually pretty tough to tell, whether or not you have an enlarged prostate just from a rectal exam. The size of the prostate actually does not really correlate with the symptoms, just because the problem is on the inside lining of the prostate. This is where the actual blockage of the bladder occurs. A lot of patients ask me, well, if I'm not too bothered, why do we really have to do anything at all? Well, the prostate over time, as it enlarges, can really affect the health of the bladder. Bladder outlet obstruction can cause irreversible damage to the bladder if left untreated. You can kind of see here a progression from a smooth appearing normal bladder to a bladder muscle that's really, increased in size, And then you even start to see these crevices for a bladder muscle that's really headed towards permanent damage. And so, ultimately, almost 90% of men who elect to watch, their symptoms end up experiencing a significant worsening over time. And ultimately, the worst case scenario is if the bladder really becomes permanently damaged, it eventually will just give up and not squeeze. And a lot of those patients are either bound to a catheter that stays in their bladder, or a catheter they have to intermittently place, or other major surgery. So again, just looking at what does a normal prostate look like? Obviously, we've shown it to you in a diagram, but also what does it look like to me when I take a look with a scope? As you can see with a normal prostate, wide open channel, what this black hole here is, that's the opening to the bladder. As the prostate enlarges, you start to see the sides of the prostate kind of collapse on itself. And then this is where it's really severe, almost what we call our quote unquote kissing lobes, where the two sides of the lobes of the prostate are touching one another. And that's, when enlarged prostate is really a bad problem. So how do you recognize the symptoms of enlarged prostate? Who is somebody that should see a urologist to prevent further bladder deterioration? These are the most common symptoms: frequent urination, going to the bathroom multiple times a night, having the urge to urinate, unable to postpone urination, even having painful urination, a weak or slow urine flow, feeling like you're not emptying your bladder all the way, and then starting and stopping. I often will say, when you're in the bathroom with a bunch of your golf buddies, who's the last one that leaves the bathroom? If that's you, and you're always the last one off the urinal, that's a problem. And so many men who suffer from enlarged prostate do actually, experience a reduction in their quality of life, not just their overall symptoms, but report that their overall quality of life is worsened. They may avoid travel, interrupt their leisure activities, use bathroom stalls, actually sit down to urinate instead of standing up to pee. And of course, disruption of sleep, which we know can affect really any organ in the body as well. So how do we diagnose enlarged prostate? Obviously, it starts with the in-person visit. We'll gather a history, kind of see what symptoms you're having, how long have you been having them for, do you have a history of infections, some other risk factors that we'll address. Of course, we'll do a physical exam. Oftentimes, you are lucky enough to get a rectal exam from me. Again, that's to kind of get an overall feel for the prostate size, and also to make sure that I'm not worried about something like cancer. We usually do a little scan in the office just to make sure that you are emptying your bladder. Many of you have had to fill out a little survey before even seeing me, or what's called the AUA symptom score. We'll give you a brief look at that. And then just how much of a bother is it to you? Are you having a lot of symptoms, but you're not bothered? Or are you having really not many symptoms, but you're severely bothered? Ultimately, my goals, I always tell people, are two. I want to prevent any bladder deterioration, but I also want to make sure that any bother you have is fixed. There's some optional studies that patients undergo. These are usually studies that we'll do maybe if you're not sure, if you're not convinced, or even if I'm not convinced, to kind of see, well, do we think the prostate's causing the problem? That may be a flow study, pressure flow studies, where we actually put in a little tiny catheter, or many of you may even have fallen victim to the Euro cuff, where we do a little blood pressure cuff around the penis and have you urinate. That checks the pressure flow. A ultrasound, with or without biopsy. Again, if there's any suspicion for prostate cancer, we'll want to sort that out. And then a cystoscopy, which is where I place a scope and actually look at the prostate visually. Here is that AUA symptom score, also known as the International Prostate Symptom Score, or IPSS. We look at all of the symptoms I named before, and we kind of score it. Are your symptoms mild, moderate, severe? But here again is that very important question: how is your quality of life? And that kind of helps tell me, where can we do better? So when we look at treatment options for enlarged prostate, they kind of range from less invasive doing nothing to more invasive, major surgery. And we'll talk about each of these, in series. Um, Everybody's different. So watchful waiting, implies that we're not going to really do, either medication or procedure or surgery. The advantages, of course, are that you're avoiding surgery, you're not paying for drugs, you're not subject to those side effects. The disadvantages, well, you're not going to see an improvement doing nothing. Of course, that goes without saying. But you risk that these symptoms will worsen. And if the prostate gland continues to grow, it may come to a point where certain options aren't available. Medications, there's both common medications. I know many of you have seen some of these medications. Flomax is the big one, also known as tamsulosin, Avodart, finasteride, even Cialis. There's also herbal remedies, the big one being saw palmetto. The big advantages, again, for both of these, no surgery, you're avoiding any procedures or surgery, and you may actually get some relief. For the drugs, disadvantages are you have to take them daily if it's going to work, and there are side effects. You can have a decreased sex drive, erectile dysfunction, ejaculatory dysfunction, dizziness, lightheadedness. Those are big ones as well. They may be expensive to you out of pocket, and they may stop working over time, even after you've taken it every day for months or years. For the herbal remedies, you may avoid actual drugs and actual drug side effects, but they've looked at these in scientific studies and really none have shown benefit. And so you're really risking that your symptoms will worsen and you may face downstream issues, like I said, bladder failure, kidney dysfunction, just to name a couple. There's the prostatic urethral lift, also known as the UroLift, which is a relatively new technology on the market that advanced urology specializes in. Advantages here, it's an office procedure, quick, takes about 10-15 minutes to do, often with just some IV sedation just to keep you comfortable. The big advantage here is it preserves sexual function, so you really have no problems with erections or ejaculation. All the scientific studies reported 0% effects, as opposed to any other prostate procedure. You will not see 0%. You get a rapid, durable relief. They have done studies that have compared the UroLift to major surgery and found that they are non-inferior. They both have the same durability. And then the one that lots of guys love, typically we don't have to put a catheter in after. If this is ultimately a procedure that we plan, of course, I'll talk to you about, the circumstances in which we might have to leave a catheter, but even so, it's usually less than 24 hours. The disadvantages, you do, experience a little bit of discomfort. Usually I tell everyone you'll have burning with urination for a few days. Very rarely does it last longer than that. You will see a little bit of blood in the urine, but very, very rare to have significant bleeding in the urine, especially compared to other therapies. You might have some urgency after procedure. Again, this is a common disadvantage for really all of these therapies, and again, something we will talk about. So how the UroLift works, with you under some mild sedation, we basically place a scope in the urethra. Here's the urethra. This is the prostate, and here's the bladder. So we'll place the scope in the urethra. We basically deliver a small needle that delivers a tab on one side connected to another tab with a suture in between that's permanent. And this acts as a compression device, almost like if you think about like a curtain holder. I also tell some patients it's kind of like stapling it. It's basically, we're not removing any tissue, we're just condensing the tissue. So that afterwards, you see a series of implants here where the channel is wide open. There's thermotherapies, meaning heat. And so there's microwave radio frequency. Some of you may have even heard of Resume. Advantages, again, this is also an office procedure, fewer side effects than surgery. The big disadvantage is you will usually have a catheter after treatment for a few days. That's because there's a lot of swelling in the prostate. The prostate doesn't love to be heated or microwaved. And sometimes you'll even have to wait 4 to 6 weeks before you get relief as that swelling goes down. And there is still the potential for sexual dysfunction, particularly ejaculatory dysfunction. And so briefly how these therapies work, again, same anatomy through the urethra. Here's the prostate. We basically inject either hot steam or heat to kill the inside of the prostate to open up the channel. And then there's laser surgery, major surgery. This is kind of the TURP. I've explained that probably to a couple of you as kind of the roto-rooter, where we actually go in and remove tissue. There's also robotic procedures where we make incisions on the skin to remove the inner lining of the prostate. Advantages are, the same as what these are going for. We're trying to improve flow. We're trying to improve your symptoms. Advantages, we actually remove prostate tissue. So we're actually able to send that tissue for pathology, but also to remove it, to prevent it from growing back. And it is durable. There's a very low retreatment rate, so it does work. Disadvantages are it's typically a hospital procedure with general anesthesia. Many of these, if not all, require hospitalization. You'll have a catheter guaranteed for at least a day, sometimes as much as 2 weeks. You'll be restricted from activity for about 6 weeks. Erectile dysfunction, almost all have ejaculatory dysfunction, risk of incontinence, risk of strictures. So it's definitely a more invasive approach. That's not my first line of therapy for anybody who's a candidate for something like the prostatic urethral lift or even thermotherapies, although those have even really fallen out of favor in my practice. So briefly, just kind of how the TURP works. Same anatomy, going with a cystoscope through the urethra, and we basically are coring out the inside of the prostate with a hot knife to remove that tissue. So thank you all for listening. Kind of what's next, listen to your symptoms. If you do not have an appointment, please feel free to make one with either me and Marietta or a provider with advanced urology closer to you. You can make appointments directly on our website at www.advancedurology.com. Just remember, we're all about treating every patient differently, about giving you a patient-focused approach. Not every patient gets the same type of treatment. We make sure we walk through all the different types of treatments so that we get the right solution for you. Just to keep in mind, advanced urology is a center of excellence in many, many locations for UroLift and treating enlarged prostate. We've done over 30,000 patients have been treated, and we've got a very highly trained, skilled team of physicians and staff that will take great care of you. And with that, here's our clinic in Marietta. I appreciate everybody for joining, and I'll take this time for questions if anybody has any.